Hey everyone, welcome to Snooze Central. Today we're going over 10 tips to help you stop snoring at night. Be sure to watch until the end because we've got the most effective tips to help you stop snoring for good. Before we get into the video, make sure to check out the link in the description for the best method to stop snoring. Now let's get straight into the video. Tip 1. Change your sleep position. Many people don't realize that their sleeping position can significantly impact their snoring. When you sleep on your back, gravity pulls the soft tissues at the back of your throat downwards, which can partially block your airway and cause snoring. This position tends to exacerbate the vibration of these tissues during breathing, leading to louder and more frequent snoring sounds. To mitigate this, consider switching to your side. Sleeping on your side helps keep your airways open and reduces the likelihood of airway obstruction. This simple change can make a significant difference in the quality of your sleep and may decrease snoring substantially. For those who struggle to maintain a side sleeping position throughout the night, using body pillows for support can be an effective solution. Placing a body pillow behind your back can prevent you from rolling onto your back while you sleep, helping maintain a side position that can alleviate snoring. Experimenting with different pillow placements can also help find a comfortable and effective sleep setup. Tip 2. Lose weight. Excess body weight, especially around the neck, can tighten the throat's circumference, increasing the likelihood of it collapsing during sleep and causing snoring. Fat deposits around the upper airway can obstruct normal breathing and are a common contributor to snoring. For individuals who are overweight and struggle with snoring, even a modest reduction in weight can help widen the airways and reduce the intensity of snoring. The process of losing weight generally involves a combination of healthy eating, regular physical activity, and sometimes consultation with a healthcare provider to address underlying issues like hormonal imbalances or metabolic disorders. It's important to approach weight loss with a realistic and sustainable plan. Quick-fix diets are unlikely to yield lasting results and can lead to a cycle of yo-yo dieting, which may exacerbate health issues rather than solve them. Instead, focus on making gradual lifestyle changes that include healthier food choices and increased physical activity. Not only can these changes reduce snoring, but they also enhance overall health and well-being. Tip 3. Stay hydrated. Staying hydrated plays a vital role in reducing snoring. Dehydration can cause the secretions in your nose and soft palate to become stickier, which increases the likelihood of snoring. Ensuring you drink enough water throughout the day can help keep these secretions more fluid and less likely to block your airways during sleep. Aim to meet the daily recommended water intake, which is about 3.7 liters for men and 2.7 liters for women, though this can vary based on factors like age and activity level. Keeping a water bottle handy throughout the day is a good strategy to ensure you meet your hydration needs. Additionally, avoiding diuretics such as alcohol and caffeine in the hours leading up to bedtime can help maintain hydration levels overnight. Incorporating hydrating foods into your diet, like fruits and vegetables, can also contribute to your overall fluid intake. Not only will staying hydrated benefit your throat, but it will also improve your general health and could enhance your sleep quality, reducing snoring. Tip 4. Limit or avoid alcohol. Alcohol consumption, especially close to bedtime, can significantly increase the likelihood of snoring. Drinking alcohol relaxes the muscles in the throat, including the soft palate and uvula, which can obstruct the airway and trigger snoring. Even people who don't typically snore may find themselves doing so after consuming alcohol. To reduce or prevent snoring, it's advisable to limit your alcohol intake and avoid drinking at least 2 to 3 hours before going to bed. This gives your body enough time to process the alcohol and helps the throat muscles regain their normal tone by the time you sleep, minimizing the risk of snoring. For individuals who snore regularly, further reducing alcohol consumption or avoiding it altogether might be necessary to see a significant improvement. Additionally, combining this strategy with other lifestyle changes, such as improving sleep hygiene and staying hydrated, can enhance its effectiveness in reducing snoring. Taking these steps not only helps mitigate snoring, but also contributes to a better night's sleep overall, leading to improved energy and focus during the day. Tip 5. Quit smoking. Smoking is a significant contributor to snoring. It irritates the mucous membranes in the throat and nasal passages, leading to swelling and narrowing of the airways. This inflammation can obstruct the flow of air during sleep, increasing the likelihood of snoring. Additionally, smoking decreases lung function, which can worsen breathing difficulties at night. Quitting smoking can have immediate benefits for reducing snoring. As the body begins to heal from the effects of tobacco, airway inflammation reduces and lung capacity improves. This makes breathing easier and quieter during sleep. Quitting smoking is challenging, but support is available, including nicotine replacement therapies, prescription medications, and counseling services. It's also important to avoid exposure to secondhand smoke, which can similarly irritate the airways and contribute to snoring. creating a smoke-free environment in your home and avoiding places where smoking is prevalent can help maintain the health of your respiratory system and reduce snoring. Overall, the effort to quit smoking not only decreases snoring, but also significantly improves overall health and well-being. Tip 6. Use nasal strips or a nasal dilator. Nasal strips and nasal dilators can be effective solutions for reducing snoring, especially if it's caused by nasal congestion or narrow nasal passages. These devices help open up the nasal airways, making it easier to breathe through your nose and reducing the need to breathe through your mouth, which can lead to snoring. Nasal strips are adhesive strips that are placed on the outside of the nose. They work by physically pulling open the nasal passages to allow for better airflow. On the other hand, nasal dilators are inserted into the nostrils and work from the inside to widen the nasal passages. Both options are non-invasive, easy to use, and available over the counter, making them accessible choices for immediate relief. For those with allergies, colds, or structural issues in the nasal passages, these devices can provide significant relief during sleep. Using them regularly can improve the quality of your sleep by reducing snoring and potentially preventing the interruptions in breathing that can lead to sleep disturbances. Tip 7. Manage allergies. Allergies can be a significant factor in snoring by causing nasal congestion and airway irritation. When allergens like pollen, dust, or pet dander trigger allergic reactions, they can lead to swelling in the nasal passages and throat, obstructing airflow and causing snoring. To effectively manage allergies and reduce snoring, it's important to identify your allergy triggers and minimize exposure to them. Regular cleaning of your living environment, using air purifiers, and keeping windows closed during high pollen seasons can help reduce the presence of allergens in your home. Using hypoallergenic bedding and frequently washing sheets in hot water can also decrease exposure to allergens. Additionally, over-the-counter or prescription allergy medications such as antihistamines, decongestants, or nasal corticosteroids can be effective in managing symptoms. These medications reduce inflammation and congestion in the nasal passages, improving airflow and reducing snoring. If over-the-counter solutions aren't enough, it's a good idea to consult an allergist for a personalized treatment plan that might include immunotherapy or other advanced treatments. Tip 8. Consider anti-snoring mouth appliances. Anti-snoring mouth appliances, also known as mandibular advancement devices, MADs, can be a practical solution for those whose snoring originates from the base of the tongue or the relaxation of throat muscles. These devices work by slightly pushing the lower jaw and tongue forward, which helps keep the airway open during sleep. These appliances are usually fitted by a dentist to ensure they match the contours of your mouth, providing both comfort and effectiveness. While over-the-counter options are available, a custom-fitted device from a dental professional usually offers better results and minimizes discomfort. Using a mouth appliance can take some getting used to and may not be suitable for everyone, especially those with certain dental issues. However, for many people, they are an effective way to reduce snoring significantly. Regular follow-ups with your dentist are important to ensure the appliance continues to fit well and remains effective. For those struggling with snoring, an anti-snoring mouth appliance could be worth considering, particularly if other remedies like changing sleep positions or lifestyle adjustments have not been successful. Tip 9. Elevate the head of your bed. Elevating the head of your bed can be a simple yet effective method to reduce snoring. This adjustment works by changing the angle of your neck and head, which can help keep your airways more open during sleep. When the head is raised, gravity is less likely to pull down on the throat tissues, potentially reducing their ability to block the airway. You can elevate your bed by placing blocks or wedges under the legs at the head of the bed, or by using a mattress wedge. An elevation of about 4 to 6 inches is typically recommended. This slight incline can prevent the tongue from falling back and the soft tissues of the throat from collapsing, which are common causes of snoring. This method is particularly helpful for individuals who suffer from congestion, acid reflux, or obstructive sleep apnea, all of which can contribute to snoring. It's a non-invasive solution that can be easily combined with other treatments, such as using a nasal dilator or changing your sleep position, to maximize the reduction in snoring. Before we get into the last tip, make sure to check out the link in the description for the best method to stop snoring. Now let's get into the last tip. Tip 10. Seek medical advice. If your snoring persists despite trying various home remedies and lifestyle changes, it may be time to seek medical advice. Chronic or severe snoring can be a sign of underlying health issues, such as obstructive sleep apnea, which requires professional medical treatment. Consulting with a healthcare provider can help determine the cause of your snoring. A doctor may recommend a sleep study to diagnose the severity and nature of your condition accurately. Based on the results, they might suggest specific treatments such as continuous positive airway pressure, CPAP machines, oral appliances, or even surgery in extreme cases. Do not underestimate the importance of professional intervention, especially if your snoring is accompanied by daytime fatigue, morning headaches, or pauses in breathing during sleep. These symptoms could indicate more serious health problems that, if left untreated, could lead to further complications. Getting the right diagnosis and treatment not only can improve the quality of your sleep, but also your overall health and well-being. Don't hesitate to reach out for help if your snoring becomes a significant disruption to your life. Be sure to subscribe and turn on notifications so you don't miss more videos about sleep. Check out this video here, and I'll see you in the next one.